Okay. So I'm gonna turn it around a little bit. I'm gonna come at this from a bit of a different perspective. At the center, we identify essentially pathways to address ethical, social, and cultural risks in both global health and global development. So it's a little bit different from, I think, what you've been listening to all day, but I hope it's interesting and gives you reason to think a little bit more about how we're moving forward with human microbiome research. The two main themes that I'm going to focus on are both governance of biological materials as well as clinical research ethics and translation. So it's been pointed out that very little to almost none of the successful metagenomic stories, and this was about 2011, had actually been translated to aspects of human health or conducted and duplicated in low to middle income countries. So that's starting to change now with the focus on improving the reference genome by understanding diversity in both Southeast Asia and Africa, I would say, are the areas where we're seeing most of that. And again, you know, the implied benefits around that seem to be around malnutrition, a priority area of research. But just starting with respect to governance of biological materials and data, although there has been some empirical work done on this subject, the nature and extent of ongoing interest in what I've started to call human-associated biological materials and data at the level of the individual, the community, and the nation is in fact not known. And for example, I think it helps to think about this material along a transition. So is it human biological material? Is it non-human biological materials, or are they actually strictly microorganisms? And there's different governance mechanisms that you need to think about if that's the case. So if we consider these materials to in fact be human biological materials that we're taking from the human gut microbiome, for example, then although there do remain some differences amongst how these should be governed, researchers can and will adhere to the existing governance mechanisms, both at a national level here in the US or in Canada, for example, but also globally. Regardless, I think the area that requires some thought will be with respect to public health interventions and return of results and the sensitivity around that. Public health is legislated and regulated very differently from the patient-physician relationship. And as these studies move forward and we gather that type of information, the obligations that we have to those people who are participating and the conflict that may come into play with respect to public health interventions could raise some serious concerns around privacy. However, if instead these materials are not actually considered human, there is an ontological question here that has yet to be answered. But they may be considered strictly microorganisms or somewhat of a mix of both. And as we all know, microorganism strains themselves can be isolated and patented. And there's examples of how this has been done in a very basic manner. So we have examples of researchers collecting samples from breast milk in Peru and taking that and developing yogurt probiotic product that was then subsequently sold throughout Europe. And they've partnered with multinational corporations in developing these types of products. And the questions that this raises are if somebody within one of those communities or groups does raise some concerns, or even at the national level, what types of governance mechanisms are actually in place to address that. And of course, there are governance mechanisms. One's known as the Convention on Biological Diversity. I'm not sure how many people are aware of this, but it actually is in place to conserve biological diversity, ensure sustainable use of its components, and ensure fair and equitable sharing of the benefits that arise out of utilization of genetic resources. It also provides sovereign rights over the samples to the countries themselves that choose to put in place legislation, and they provide guidance on how that can be done. Genetic material, of course, means any material of plant, animal, microbial, or other origin-containing functional units of heredity. And genetic resources mean genetic material of actual and potential value. There is precedence for how this has been applied in the past in a rather negative way that turned out to be positive. I'm sure many of you are familiar with the fact that in 2006, the Indonesian government declined to share virus samples. These were, again, obtained in a similar fashion as would be microbial samples from humans who donated the samples from their physical bodies. The Indonesian government actually declined to share their virus samples, and the international community raised concerns that the subsequent developed vaccines would not be accessible to their population. Although it was highly criticized and considered a really poor way of applying the Convention on Biological Diversity, it did have the desired effect for the Indonesian government, and it ensured that the WHO reached an agreement that ensured an equitable distribution of benefits So again, what we have there is the importance of adequate and responsive benefit sharing agreements when doing research in these populations. I also want to speak to international clinical research ethics, particularly that in low to middle income countries. There is a need to ensure informed consent to account for sociocultural perspectives of the meaning and significance of the human microbiome and its manipulation, respect for recruited participants in study communities, and the appropriate development of intervention and/or therapeutics. Microbial research and the translation of said research may be considered more invasive or less culturally accepted by some of these groups. For example, the use of microbial strains obtained from research participants to colonize notobiotic pigs may raise concerns in Islamic communities in Southeast Asia. Likewise, an ingested therapeutic nutritional supplement developed using an experimental pipeline that involves notobiotic pigs may cause Islamic populations to decline participation in research. In another example, researchers may need, in fact, to consider milk kinship in Islamic communities. I'm going to finish there, but just say that I think it's very important that the appropriate development of interventions and/or therapeutics also take some of these sociocultural relationships into account.
Great, thank you, Billie-Jo. Over to Scott.
Okay.